More than 3,000 people have died of COVID-19 in India in the last 24 hours, a new record for the country. This makes India only the fourth country in the world after the United States, Brazil and Mexico to cross 200,000 deaths during the coronavirus pandemic. This at a time that India added more than 1 million cases in just the past week alone. The reality of these deadly numbers plays out in India's hospitals and medical facilities every day. Stretched to the limit, they are running out of supplies, primarily oxygen. People desperate for assistance have turned to social media. Pleas for help are being posted, and those who can are responding with information on platforms like Facebook, Instagram and Twitter. Such as this user in Mumbai who's saying that oxygen is available for those in Delhi at the Sikh temple in Ghaziabad city in northern India. This user in the southern city of Bangalore posting verified information about someone who can help deliver medicines to elderly patients staying alone. And this group of COVID volunteers in Pune in western India with, again, verified information about beds and oxygen being available in the city of Nagpur in western India. And joining me now, the person responsible for that last tweet you saw, Nitesh Singh from Team SOS India. He joins me from Pune in Western India. And we also have Pooja Iyengar, who's working in the city of Bhopal in central India to help those battling the current COVID crisis. Welcome to both of you. Nitesh, I'd like to come to you first. How are you collecting information and being able to verify what you are posting?
Okay, so basically, Team SOS India have 120 volunteers, so they are spread across across nation. And what they do is they collect information. If we get any information on social media, or we call hospitals, or you can say the labs and everywhere, and we verify those details. So every detail that are spreading all over internet, we collect them, and we verify them, and then we post those information on Twitter.
Now, Pooja, as I understand, you are doing much the same thing as Nitesh in Bhopal, but you're also helping out with a community kitchen in your city.
Yeah, we are a group of 150 volunteers, and some of them are helping with getting ventilators and beds for people. But there are a large number of attendants who are waiting outside the hospitals. They are not allowed to go in, and their family members are inside, and it's a long, endless wait. And since it's locked down and there are no shops open, so we decided to start a community kitchen for them. It's a crowdsourced thing, and people have generously donated, and we have started a kitchen where we can give them food, water, lunch, all these things, so that, you know, the wait becomes a little bearable.
Nitesh, as I understand it, you set up Team SOS India last year as the first wave of COVID infections was hitting India. And I need to mention here that you are in Pune in Maharashtra state, which is possibly the worst affected state in terms of COVID infections in India. Did you ever imagine that things would ever get this bad?
So, when the first wave ended, we were like, we will not hear about this COVID again. Since the vaccination was started, people are getting vaccinated. So we never thought that we will see the second wave, let alone this this much impact. It was not we have imagined.
It is something that hits me hard as well, because I would never have imagined, like you, Nitesh, potentially, that things would ever become as bad as they are in India. And therefore, Pooja, I wonder if you think it is essentially left to citizens such as yourself and Nitesh to organize help because the system is not being able to cope.
It's a huge crisis, and the government is doing what it can and to the best of its ability. And I feel that everybody has to join hands and, somehow tackle this situation. And we are sitting at home, we are receiving calls, and sometimes people are just panicking also. So we take those calls and try to give them some emotional support, because in our family also so many people are COVID positive, and everybody has gone through a similar thing. So we can, counsel them, help them, And the entire country has to unite and everybody has to stand together. The government is doing what it can, but we also have to rise to the occasion, I feel.
Nitesh, personally for you, I mean, as Pooja was saying, I think nearly every Indian knows somebody who's been affected by this crisis. What is it like for you to be able to run this network of volunteers and to provide information to other people, knowing full well that people in your circle might be affected?
So, like recently, my fiance got she got COVID last month. So it was a pay. I never thought that in my family I will see someone like we are taking every precaution and everything. So this is something even I cannot say. This is something I told you that we cannot imagine what is happening around. Every day we are facing new problems.
Pooja, do you think India could have been better prepared for a potential second wave?
I am actually the first wave that hit us. It was more of the migrant laborers, and we were, it came as a jolt. We were trying to prepare ourselves, but we didn't know that the situation will get this bad because the first wave wasn't so severe. So I don't think anybody expected this. Like right now, my mother is COVID positive, and I am going through the same thing, and there are so many others also, and it's happening in every house. So the magnitude of this thing, nobody could have imagined. Yeah.
Nitesh, one last question to you. Do you think the work that you're doing through Team India SOS will only keep expanding, and the work that you will have to shoulder on a daily basis will only become more and more as we go along into the next few weeks?
Yeah, I can tell you that because we are expanding our volunteer networks. I told you that we have data team of 120 people, then tech team of 20 people, then we have data analytics team of 20 people, then we have team which handle bed, plasma, and blood requests. So we have like right now, on a total strength, we are 627, 70 more people are joining in today. So,
Right.
and we, even though we have this much strength, we are not able to we are still faced the work is more and we have less people with us.
We'll leave it there for the time being, but thank you so much for joining us, Nitesh Singh and Pooja Iyengar. Thank you very much, both of you, for the work that you're doing for fellow citizens.
Thank you.
Let's take a closer look at this with Smriti Shalini, who's a community organiser in Delhi, who helps organise resources via social media. Welcome to DW. What are people most in need of when they contact you?
They mostly contact us for, last week it was RT-PCR at-home collection tests. This week it is oxygen cylinders. And I'm afraid to say now it's mostly there's a cry for help for ventilators and hospital admissions. Whereas that there's only so much that our healthcare system can support right now. So we are still trying our best that we identify the need at a right time, wherein we don't have to wait for things to get to worsen, and so that we can just help them when they need it and when it can actually help them. There's no point in getting an oxygen cylinder to them when the SpO2 levels have dropped to 40. So that's something that is very distressing to even people like us who are helping people through social media. But that's one thing that we are finding ourselves very distressed about.
Right.
That people are crying for help, and it's a shame that people are dying not just because of COVID, but because of the lack of treatment and resources for COVID. That's the most unfortunate part of this whole crisis.
And as if to make exactly that point, I'm aware that you've recently lost your own grandfather to COVID, and he was quite a man.
Yes, he was. He was the past president, the past national president of the Indian Medical Association, which is the only national representative voluntary organization for the doctors of modern medicine. And he had dedicated his life to public service. There are thousands and lakhs of patients that he has treated. And he was 90 years old. And I don't know how long he would have lived. It's unfair to even say that he would have, make assumptions. But what saddened me was that a man of such stature, he had to leave us, and in such a sad manner, because for the lack of oxygen. I myself must have called 50 numbers, and the helplessness with which the vendors replied for oxygen refilling was something that I can't even blame them for. They don't have oxygen. Where do I get it from? Where do they get it to me from? So that was a very unfortunate thing, but I hope it went to somebody who was more in need, and my grandfather would have wanted the very same thing, for it to be to reach someone who was more in a way that who would have made more use of it, if I can put it like that.
You can indeed. And we're sorry for your loss, and thank you so much for joining us, Smriti Shalini in Delhi.
Thank you. Thank you so much.
With India struggling, countries around the globe have been lining up to provide help. Oxygen equipment and other supplies have arrived from the UK, with more on the way from Australia, Germany and other countries. Also, the worldwide Indian diaspora is contributing what it can. Here's some London-based volunteers sharing their experience.
The temple was very quick in setting up a fundraising campaign. It was overwhelming support. Our online websites, the telephones here at the temple were ringing hard and fast.
I have phone calls coming from my Pakistani friends, Muslim friends. They want to help as well. They say, look, Rajneesh, please advise which charity we can do it. We want to do it because it's not your problem. It's a united. It's a humanity problems. Whatever we can do, we should help it. So yes, they are coming together.
We had reached over £100,000 of donations, which we transferred quickly to India and got translated into medical provisions, non-medical provisions, therapeutics. So people, in India were able to benefit from the donations of the British Asians.
And while those donations make their way into India, the virus begins its spread outside. There's concern in neighboring Nepal after a rapid rise in coronavirus cases attributed to the strain of the virus causing havoc in India. The Nepalese capital, Kathmandu, is already struggling with increased hospital admissions and resources stretched thin.
Nepal bracing for another wave of coronavirus infections. Citizens in Kathmandu are lining up to get their tests, hoping to be negative as cases surge in a rapid speed. The sharp rise, fueled by the more infectious mutant strains from neighboring India. Border cities have already become hotspots, and doctors fear that the capital will soon follow. The situation at the border town of Nepalganj reflects what's happening in India, and I call it mini India. If the same thing replicates in a densely populated city like Kathmandu, the situation would become much more difficult. Vaccine efforts in the Himalayan state are complicating the situation. About 7% of Nepal's population have so far received a shot. But the country is struggling to procure more doses as it relies on supplies from India. There, authorities have prioritized their own needs as the situation runs out of control. That could soon be the case in Nepal if the trend continues. In Kathmandu, the health system is already stretched. People are struggling to find hospital beds for their sick family members. We brought him to the hospital in an ambulance as he was facing breathing difficulties. The doctors haven't attended to him. Everyone's busy. Busy and worried, as the more infectious variants also hit young people and children harder than before. It's a crisis that's set to become worse here before any improvement.